Hi guys, my name is Sandra Lopez and today I will be talking about training and development of public health officials in California. Throughout my presentation, I will be outlining challenges and some possible solutions for these challenges. First of all, what is public health? According to the American Public Health Association, APHA, public health promotes and protects the health of people and communities where they live, learn, work, and play. A public health official addresses the needs of community through community-based prevention programs. A public health official looks at the morbidity and mortality rates of different populations based on race, class, and gender. With these rates, public health officials plan a prevention program that can possibly alter the behavior of the target population they're serving. Public health officials can work in different settings, such as government, health departments, universities, or public sector research organizations. So what is one HR function challenge? So one HR function challenge I found throughout my research is that in California, supplying experienced and qualified public health officials is a big need. Public health officials are not trained to deal with unexpected disease outbreaks. An example of this is the measles outbreak back in 2014 that was linked to Disneyland Park visitors, where multiple visitors were infected with the virus. This outbreak was surprising to many public health officials because we don't see too many cases or outbreaks like this in the U.S. We see most cases like these outbreaks in third world countries that are underdeveloped nations of the world. The majority of the individuals infected with this outbreak, with the measles virus, were those who were not vaccinated. So this is a big challenge for public health officials because the need of great communication skills to inform and persuade individuals, like in the example of the measles outbreak, to get vaccinated to improve their health and lives of others. Informing, meaning providing factual information with no intent of influencing a decision. Persuading refers to using information to help change opinions, attitudes, or behaviors, and is probably the most common purpose for communication in public health practices. An example with these skills that are being put to use is when encouraging smoking prevention and cessation, condom use, early prenatal care, prevention of driving under the influence of drugs or alcohol, or immunization of young children. In this case, the measles outbreak would have affected less people if parents and young children were vaccinated. This is another big challenge public health officials are facing in California, especially a diverse state. Being culturally sensitive is a must to promote health and well-being. So, what are possible solutions for these challenges? So, possible solutions to these challenges are creating trainings for public health officials to attend. As stated before, being culturally competent is also a big challenge for many public health officials in California. Culturally competent is defined as the ability of providers and organizations to effectively deliver healthcare services that meet the social, cultural, and linguistic needs of patients. Meeting these needs of individuals and or communities need to be accomplished by being culturally competent. Reducing barriers such as language and communication would be a best way to approach this situation. In this case, in public health here in California, public health workers need to be trained to be better prepared in dealing with different ethnic groups and getting to know their beliefs and values and how these beliefs and values play a huge role in their lifestyle. For example, vaccination. There are some religions that prohibit vaccination. Breaking this barrier may be a great challenge for public health officials, but understanding their beliefs and persuading them the best way possible for the best of themselves, family, and the public to get vaccinated is the need to have great communication skills. These trainings will consist of better preparing officials to use tactics that can break these barriers and use the severity of the situation to convince the individual or community to change their behavior or make a change to better their well-being. In addition, these trainings will also consist of how to better improve leadership, management, and program evaluation. I recommend that public health officials be trained through hands-on experience, and get the feel of how it is working in this field. A public health official has no time to fail because effort and money is being put to create a prevention program in the community setting that is wasted and failed because it was not implemented effectively. Therefore, I recommend extra training to be conducted to break these challenges many public health officials face. Thank you.